So the question is about sperm retrieval and surgical sperm retrieval, because of course the only way we can get sperm from the testicles and from the tubes on the side of the testicle is by a surgical procedure. Now there are two reasons why a man has no sperm in his ejaculate. That is either because there is an obstruction somewhere between the testicles, the factories, and the tubing that leads into the penis so that the sperm can be ejaculated, or it is a non-obstructive failure to have sperm in the ejaculate, known as a non-obstructive azoospermia. So sperm retrieval is useful, particularly in men who have no sperm in their ejaculate, in what they're producing, because there is an obstruction. Now this of course means that the testicles themselves are working fine, but the sperm can't get out. And this means that there will be sperm in the testicles and in the little tubes on the side of the testicles called the epididymes. That's the plural for epididymus. And then we can either put a needle into the epididymis, or if the sperm is in the testicle itself, undertake an operation in which we can open the testicle and then use an operating microscope to identify the larger tubules in the testicle itself where the sperm is being produced. And then that sperm can be prepared and frozen for subsequent use. Now, some of the patients don't have obstructive azoospermia, they have non-obstructive azoospermia. And in these men, we know that approximately 50% of them will have little islands of sperm production in the testicle itself. And these patients can undergo the microtesticular dissection procedure, which involves opening the testicle, as I've just explained, and using the operating microscope to find these little islands. Now, in non-obstructive azoospermia, one can only perform the microtesi for sperm retrieval because there are only these small islands of sperm production identifiable by the microscope. For some patients with non-obstructive azoospermia who are seeking sperm retrieval, we might undertake a diagnostic procedure first. This is called a fine needle aspiration or testicular mapping procedure. And it is only diagnostic. It doesn't actually retrieve the sperm, but it tells us whether or not these little islands of sperm production exist. And of course it tells us where they exist, so that at a later date we can undertake the microtesi directed to the areas that have been indicated by the map that we've previously made. Now this of course has its advantages and disadvantages, because the testicular mapping procedure means that for a man with non-obstructive azoospermia, he will have an extra diagnostic procedure before he undertakes his sperm retrieval by microtesi. But the advantages are that we know whether there is any sperm production and where it is, and therefore when it comes to the sperm retrieval, the patient undergoes a smaller procedure in terms of the amount of cutting and surgery and stitching, and also we may be able to undertake the microtesi when we know there is sperm there at the same time as his partner has his egg retrieval, has her egg retrieval. And this of course means that we're using fresh eggs and fresh sperm rather than frozen sperm. Now, there's a great debate about whether or not frozen or fresh sperm taken from the testicle is better. And it's very difficult to know which is the most successful outcome with regard to fresh or frozen sperm. What we do know is that sometimes when you freeze these immature sperm taken from the testicle, they do not survive the freezing and the thawing procedure. But the counter-argument is that those sperm that do survive the freezing and the thawing are necessarily the better sperm, and therefore the strength of those sperm and the success of using those sperm outweighs the problem with sperm not surviving the freeze-thaw. So I think the jury is out over the frozen-fresh argument, but